Shocking figures from the HSE show us that 27% of all deaths during COVID were of people in nursing homes. It's a shocking reminder of how we failed the most vulnerable cohort during the pandemic. Now, I, along with others in this House, sat on a special Dáil committee during COVID, which had as a priority recommendation that the state should conduct a full inquiry into the deaths of these people in nursing homes during that crisis. We're still waiting to hear news of that inquiry, but that committee also looked at other aspects of the state's failures when it came to caring for the elderly in nursing home settings. And the one startling figure that stood out was that 80% of nursing homes are privatised in this country, 20% are public. The figure was the reverse only 15 years ago. And the reality is that many private nursing home settings could not get qualified staff, could not retain staff, didn't have medical resources to care for the people who got sick. And when it came to the issue of oxygen tanks and PPE, they were totally inadequately resourced. And we had a race to the bottom in terms of paying conditions for those who worked in those nursing homes. So my question is, are we going to learn the lessons? Are we going to have that inquiry? And will we stop the failed policies of privatising healthcare, particularly healthcare for the elderly? We have seen since numbers of very, very large healthcare centres, privately owned and operated, being opened up in a, sort of cut the ribbon of grandeur with the Taoiseach and others presiding over it, when a commitment was given that we need to move to more localised, community-based, smaller residential settings in order to prevent this tragedy in the future.
Thanks, Deputy. You should put as best you can.
And Carl, I appreciate a huge number of deputies asking very important questions here, but I jot them down as quickly as I can, and 18 deputies with about 3 questions each is nearly 60 questions. So I guess I just try and answer as many as I can, as best I can in the time available. Deputy Dillon raised the issue of the emergency department in Castlebar, which needs to be extended, and I very much agree with his remarks on that. I'm not sure if it can be fast-tracked, but I'm working with Minister Donnelly and Minister Donoghue to see if there are particular health projects that we could fast-track, particularly those that involve expanding emergency departments or involve additional bed capacity. There are a number of similar projects in the West region. Just on Friday, I was in Portiuncula Hospital in Ballinasloe, visited the hospital and the emergency department. It's a good ED, but a really small one for one that takes 30,000 patients every year now, and another one that needs an expansion. Good to see that the additional 50-bed block and 12-bed additional isolation ward is under construction there. In relation to the urgent care centre in Connolly, Deputy Dolly and I share constituency. He'll know as I do that it is a really good facility, has been a big addition to paediatric healthcare in the area, has dramatically improved the experience of urgent care for children in West Dublin, in Meath, in North Kildare. The same goes for the one in Tala. There is a new online booking system. It's been brought in because of a massive increase in the number of attendances, way beyond what was ever intended. It is for a trial period, and I don't know if it's going to work or not. Didn't particularly like it when I heard about it, but it's a decision that they've taken, and it is for a trial period. I think it may work for some people. You might have a kid with a high temperature or a minor injury, and you'd rather get an appointment in 3 hours than sit in the waiting room in 3 hours. So it might work for some people. But I take the point that the deputy makes around people who are digitally excluded, who mightn't be used to using computers, and it may have the perverse effect or the unintended effect of just increasing attendances in Temple Street down the road, and that's what we want to avoid. So we'll see how it goes, and if it works, it works. If it doesn't, it doesn't. Deputy Moynihan asked about. Should I continue or?
You might as well.
Okay.
We'll take the time from the next group.
Deputy Moynihan asked about shortages of medicines, and as he acknowledged that these aren't unique to Ireland and have happened in the past, but it is worse than I've ever seen it anyway. I'm told that alternative treatments are available for every single product that's currently in short supply. So shortages of certain paracetamol, amoxicillin or penicillin products relate to individual line items and don't represent an entire portfolio. Unexpected surges in demand, such as we've seen, take time to resolve as the industry increases production to bring the supply chain back to normal and medicine supply continues to improve. The Department of Health is engaging closely with all stakeholders in working to mitigate the current immediate shortages. The Department of Health has analysed products currently listed as short and can confirm that the reimbursement price is not the root cause of the shortage for any of these products. The increase in notifications of shortages in recent months is directly related to the increased demand due to the winter surge. The HPRA is working with all marketing authorisation holders to increase supply. They'll continue to offer regulatory flexibility where possible to suppliers. The HPRA has secured additional stock for many of the items that are in short supply, and the HSE has issued several memos to prescribers and pharmacists, including clinical advice and up-to-date information on available products, and a dedicated web page has been developed to allow prescribers to check on what's available to supply at the moment.